Hey, everybody. I want to address a question that I think you're going to be asked probably very frequently. And that is, what's different about this blood test that I didn't already get from my doctor, the blood test that I get from my doctor annually? And the answer to that question is everything that your doctor orders is, of course, also going to be in our lab test. But we're going to order a significant number of markers in addition to that. And the reason for that is your doctor is very concerned about whether or not there's a disease process that is occurring. So they're going to order things like CBC, a complete blood count, a complete metabolic panel, something called a Chem14. They're going to order a lipid panel that's going to look at all of your cholesterol and triglycerides. And they're going to order probably a TSH to see whether or not you might need medication for your thyroid. And that's a very basic panel. And that's important. We look at all that information because it's important to us as well. The reason why it's important to your doctor, again, is because they're looking to identify the need to treat a disease or to avert a crisis. And the reason we look at them is not only we would like to identify those things as well, but more importantly, we'd like to see if there's a possibility of us pushing you actually towards a better state of health. And are there any deficiencies? So what we do is, in addition to those tests, we're going to add a few more markers. And those markers have a lot to do with things that are important to a chiropractic patient. For example, several different markers that we look at for inflammation. Also, we're going to look not just at one marker of inflammation, but several. Now, you only need one for us to be concerned about inflammation, but there are several for us to look at because it kind of tells us what kind of inflammation it is or where it's coming from, so we can address that. But what's also very important to all chiropractic patients is whether or not they are not only inflamed, but how ready is their immune system to protect them. You know, you can't heal, and that's why we go to chiropractors, because we want to heal. You can't heal without an effective immune system. So we want some of that information as well. We also want to look at whether or not our hormone system, and the hormone system are hormones associated with how we deal with food, how we produce energy, not simply just our sex hormones, which is what we typically think of when we hear the word hormone. We think about estrogen, progesterone, testosterone, but we're also concerned about thyroid hormone and what it does after it's produced and it leaves the thyroid to circulate around your body. That's why we order some additional markers for thyroid health, not only the ones that tell us whether or not you need medication. But we're also going to look at certain nutrients that you need in order to have normal function. So for example, we're going to look at things like vitamins like B12, folate, vitamin D. Those are the reasons why we add or layer on top of those blood tests some additional markers that are much more important to you as a chiropractor.